everyone, welcome to Doc's Thoughts. So I'm going to spend some time today talking about heartburn and GERD, otherwise known as gastroesophageal reflux disease. On a personal note, I experienced this a few weeks ago, and typically when I experience things, I want to talk about them, and it's obviously an important topic because a lot of us deal with this problem, and there's a very big discrepancy between how we treat this in the Western medical world versus more of the integrative natural world. So I'm going to talk about both options and things you can do if you're experiencing this yourself. First things first, what is heartburn? So heartburn is that feeling you can get in your chest if you have acid that's going up into your esophagus. It can feel like a burning, it can feel like a discomfort, but it's definitely something that you feel. Some people have it often and they need to take medications to prevent it. Some people have it off and on for various reasons. GERD, otherwise known as gastroesophageal reflux disease, is just the actual process of these contents going into your chest or into your esophagus. So it is the reflux of stomach contents into the esophagus. GERD can cause heartburn, but it doesn't always. So you can have this thing called silent reflux where you're refluxing, but you don't feel it, so you don't know what's happening. And that's an important concept because if you have constant reflux of acidic contents into your esophagus, that can cause long-term problems, even things like cancer. So it's something that's definitely really important to know about. What are some of the things that cause this? So some people just have it, they're born with it, there's really nothing they're going to be able to do about it. That's probably more of the rare case. Most of the things you can think about that cause it would be things like stress. It's been proven that stress can cause reflux and heartburn. There's obviously certain foods that can cause it, so more acidic foods, tomatoes, spicy foods, coffee, fatty foods, specific foods can cause it. Alcohol definitely causes it. So too much alcohol will actually relax the sphincter that keeps the stomach contents in the stomach, and so it allows them to reflux up into your esophagus. And then there's structural issues. So if you're someone who's obese and you have a large abdomen, that's going to create pressure, which therefore will create the ability for these things to reflux up into your chest. So that's an anatomical issue. Pregnancy obviously will do the same thing because you get more stuff in your belly. And then you can have something called a hiatal hernia. So a hiatal hernia is when your stomach that's supposed to be in your abdomen herniates up into your chest. So just a little bit of a word on anatomy, the anatomy of digestion. So anytime we talk about your gut or digestion, you want to think about the anatomy. The anatomy of your gut starts with your mouth, then it goes to your throat and your esophagus, then it goes to your stomach, and then you can't see below this, but it turns into your small intestine and then your large intestine, and then you have your rectum and your anus, and then you have where your bowel movements come out or your poop comes out. That's really the anatomy of the gut. So when I'm talking about heartburn and reflux, we're really working mostly with your stomach and the esophagus and your throat, and the valves that are in between those things. So that's an important anatomy to know when it comes to heartburn and GERD or gastroesophageal reflux disease. Other things that can cause it is tight-fitting clothing. So people actually, I have one patient who says with tight bras, she was feeling like that actually can cause some of her heartburn, or tight pants obviously can cause that. And those are some of the biggest causes I would say that are common. What are the symptoms? So obviously burning is the main symptom. So if you actually feel a physical burning in your chest or a reflux feeling, that's kind of a no-brainer that you're having some heartburn. People can get a lot of other things. People can have chronically bad breath. They can have a sore throat. They can have a chronic cough because the reflux things are affecting their vocal cords. They can have a wheeze if it starts to affect their respiratory tract. They can even have dental issues. So some people will actually have a breakdown of the enamel on their teeth if that reflux is going into their mouth and breaking down the enamel on their teeth. So it doesn't always have to be heartburn for you to actually have this reflux happening. So that's important to know about. And it can be really dangerous. Again, like I said, if you have ongoing heartburn or reflux and it's not treated, you can damage the cells of your esophagus, and that can cause cancer. So there's something called Barrett's esophagus. Definitely not something you want to deal with. So what can we do to help treat this problem, whether it's heartburn or gastroesophageal reflux disease? So I'm a big believer in actually finding out if you have it or not. So if it's more than a mild case, you might want to go and get a scope. So see a GI doctor, have them put a camera down your throat and actually physically look at what's going on. That will give you a lot of information. First of all, it'll rule out if you have any really bad damage to your esophagus or your stomach. It might show if you have what's called that hiatal hernia that I was talking about, but it's going to tell you if there's some structural damage that you need to know about. So that's pretty important. Beyond that, if it's just mild heartburn that you're dealing with, or if you've already done the scope and things look normal, there's kind of two paths you can go down. If you do the traditional medical route, you're usually going to be told to take some type of a drug, like an acid blocking drug or a proton pump inhibitor. Most of us are now realizing that a lot of these drugs are found to have some maybe negative long-term side effects. And what we know is that stomach acid isn't really the bad guy. So you do want to have a certain amount of stomach acid to aid in digestion. So fully blocking this isn't always the answer. That being said, there are some patients that no matter what, they do need to be on the drug. So it doesn't mean that you should absolutely not be on the drug. But I try to tell my patients, work as natural as possible and on everything else. And then if you do need to be on the drug, fine, you've tried everything else. But for the most of the time, people will not need to be on chronic medication for their heartburn or their reflux. So some of the things you can think about using and doing in your life if you're someone who's suffering from heartburn. First of all, you want to obviously think about the physical issues. So if you have a big hiatal hernia, is that something that needs to be operated on? Is it small enough that maybe you could actually get some therapy done on your stomach? There's something called visceral therapy. There's chiropractors who actually can have some pretty good results with small hiatal hernias. Sometimes it'll come back, but some people do really well with physical manipulation. So work on that. Are you someone who's obese? Obviously, we know the answer for that. So get help in trying to lose that weight and reduce that belly load that's causing the reflux up into your chest. If you're pregnant, obviously time will take care of that one. Then there's other things you can think about as in supplements. And then before I get to that, I'll talk about foods. So food is a really important one to think about. So first of all, the easiest thing to do if you're trying to adjust your diet to help with heartburn or reflux is to just move towards an anti-inflammatory diet. So an anti-inflammatory diet is a diet that is low in added sugar, low in processed foods, high in foods that are healthy and full of vitamins and minerals and nutrients, and full of plants. So it's more of a plant-based, high-fiber diet. It doesn't mean you have to be vegetarian. It just means that you're also incorporating a lot of plants in your diet. That is an anti-inflammatory diet. I find with my patients that most of them can get resolution of their reflux if they're eating a standard American diet, which is the more unhealthy diet, and they move to an anti-inflammatory diet, they will usually eradicate their reflux. So that is always step one. If you're someone, however, that's already eating fairly healthy and you're still suffering from this, that's when you need to start to look at other things. So are you drinking too much alcohol? Alcohol is a no-brainer. That needs to be cut out if it's causing reflux. Do you have a problem with gluten or dairy? So if you're already eating the healthy diet, but you do have gluten products and dairy products in your diet, I would highly recommend doing, maybe a 2-week protocol where you take those foods completely out of your diet. So go dairy and gluten-free for about 2 weeks. And see if you get better. If you do get better, those foods might be something that you react to. And there's different reasons why you react to those foods that are beyond the scope of this video, but that's something you can definitely try. So do a little bit of elimination of foods. And then work a little bit with the other foods that are acidic, so tomatoes or removing coffee. There's certain foods that can be healthy, but sometimes they're ones that trigger heartburn, and you might want to take those out of your diet for a while. So those are some things you can do with food. And then, like I said, there's supplements. So I love supplements and herbal products for heartburn. They're super powerful, and there's multiple different classes. And really, it's a trial and error kind of thing. So you can try them out and see which ones work for you. And usually, people will do well on a combination of things. They can be used as needed, or they can even be used on a daily basis. And I'll just kind of walk through those with you. So the first thing to think about with supplements is barrier supplements. So what I mean by barrier is it's a supplement or a product that actually creates a barrier between your intestinal lining and the contents of your intestines. So if you have a lot of reflux happening, that reflux is going to irritate the lining of your esophagus. And so you want to create a barrier or a protection so it doesn't burn. So things like aloe. Aloe juice is super powerful. Make sure you're doing inner leaf aloe and not whole leaf aloe, because whole leaf aloe is a laxative. So if you do whole leaf aloe, you're just adding another problem to the equation. So inner leaf aloe juice can be super powerful. I have patients take a shot of that a couple times a day. I use that myself if I ever have heartburn. It works really, really well. DGL licorice, and what DGL means is it's been deglycerated. I think that's the right way of saying it. Because pure licorice can cause problems with your sodium and potassium, so they remove that problem from the licorice, and then it's safe to take all the time. So DGL licorice also creates that barrier and can be very therapeutic. I use DGL licorice all the time when I'm taking my patients on a little bit of a taper off of their proton pump inhibitors or their acid blocking drugs. We use it to help bridge them to not being on anything. And then there's really awesome teas out there. So there's tummy teas, throat coat teas. And basically what you want to do is you want to look at the ingredients of that tea and look for things like licorice and chamomile and marshmallow root and I'm trying to think of the other ones, but those are some of the names you want to look for. And those things are all going to be soothing and coating, and those can be taken every day. So when I have patients who come in who are super flared up, I have them drink a couple cups of that a day. There's also some really good herbal stores you can go to that will kind of hand blend those things for you. So look for somewhat of a throat coat or a tummy tea. And they also sometimes will have like debloating agents in them as well. So they work really, really well. Then you can work with the acidity and the bacterial component of your digestive tract. So a lot of us think that heartburn always means that we have too much acid. We've found that in some cases it's actually not having enough acid. So it never hurts to try a little apple cider vinegar to see if that helps with your heartburn. The way you take it is you can do a teaspoon up to a tablespoon in about 6 to 8 ounces of water and drink it and see if it helps with that heartburn feeling you're experiencing. It's just going to really need to be an intuitive thing. So you're either going to feel better with it, you're not going to feel better with it, or you may even feel worse. You obviously know what to do depending on what outcome you come up with. Another thing that works periodically, I definitely wouldn't do this every day. You should not do this every day, is actually baking soda. So you can take a teaspoon of baking soda and mix it in 8 ounces of water. I think it's a teaspoon, but maybe check me on that one, or I'll put it in the show notes. And you can drink that for temporary, immediate relief of heartburn. That one I've actually used. It worked really, really well for me, just for a periodic case of heartburn that was bad and got rid of my symptoms right away. So that's definitely something you can use. What's nice about these things is these are things you can just keep around. So I have a bottle of aloe juice I keep in my fridge. I obviously have baking soda. We all have baking soda laying around. You can keep the tummy tea laying around. These are all just nice natural remedies that you can use without having to pop over to the drug version of these medications. So they're really, really nice. Then you have to think about movement. So obviously, if things aren't moving through you, they're more likely to reflux up, right? So you want to make sure things are moving through you. So if you're constipated, which I'm not going to address how to take care of constipation in this video, address the constipation. Because that can make things back up. Also think about using things that help move things along. So ginger is a really, really powerful thing to use for any kind of digestive issues. It is a prokinetic, meaning it kind of helps move things along. Ginger can be used in capsules, chews, teas. I think tea is probably the best way to do it. And it's really easy. You take a little 1-inch knob of ginger, you peel it, and then you put it in a cup, pour some hot water over it, boiling water, and let it steep for about 5 minutes. And then you can add some lemon, you can add a little bit of honey, and that is a really, really powerful digestive aid that is obviously super cheap and super, super safe. And I've used that all the time as well. And then things that are also good with movement are bitters and fennel. So yeah, I'm talking about bitters, the kind you use for alcoholic beverages. They actually make specific bitters for digestive use. You can literally just take the regular old bitters, put a few drops in some water, and drink that right before you eat. That can be really powerful. Fennel, same thing. A lot of Indian restaurants that you go to, they actually serve fennel seeds, at the restaurant to help with digestion. It helps with bloating and gas as well. And then you can also use digestive enzymes. So as we get older, a lot of us lose our stomach acid. A lot of us lose our digestive enzymes. I'm not saying we lose them all the way, but their potency goes down. And some of us will have gallbladder issues, and we don't make the things that break up our fat as well. So digestive enzymes actually are products that have parts of those digestive enzymes in them to help aid with digestion. So there's various different types of digestive enzymes. They can be plant-based or they can be animal-based, beyond the scope of this discussion, but digestive enzymes can work really well. If you do have a problem digesting fats, especially if you've had your gallbladder removed, then adding a little bit of ox bile in there can be really nice as well for that. And there's a lot of products that will combine both the digestive enzymes plus the ox bile. And then lastly, other things to think about when it comes to heartburn. that are a little bit not as commonly thought of is melatonin actually can be really powerful. So melatonin is the hormone that we produce mostly when we sleep. It helps us sleep. A lot of us know melatonin for that purpose. We take it at night to sleep. It also can help with heartburn. So melatonin is something you can try. People usually take it in a little bit of higher doses, like 5 to 10 milligrams instead of the 1 to 3 that we use for sleep. But it's also super safe. And then also beyond everything else we talked about, consider something called small intestinal bacterial overgrowth. Now, this isn't something that you can diagnose yourself with just by listening to this. But small intestinal bacterial overgrowth is when the normal healthy bacteria that are supposed to live in your digestive tract and your lower intestines have actually overgrown and overmultiplied and are going up into your stomach and small intestine and creating some pressure and distension and things higher up. I can't even tell you how many patients I've had who have had chronic heartburn, and we treat their SIBO or their small intestinal bacterial overgrowth, and their heartburn is gone completely. So as you can see, the whole point of this is not to help you really necessarily doctor yourself. I think you can use some of these things and relieve temporary symptoms. But if you're a chronic heartburn sufferer, know that there's help beyond just the traditional medical drugs. I believe in them if we need them, but it's definitely worthwhile to look at all the other possibilities to help you eradicate or ease your heartburn before you jump to the drug, just because of the negative downstream effects of the drug. So think about all those things. If you are a chronic heartburn sufferer and it's beyond the simple tricks and tips that I talk about here today, I would definitely see someone who does either integrative or functional medicine, and get some testing and protocols done through them, and see how well you can feel without having to jump to the drugs. So thanks for tuning in, you guys, and I will talk to you again soon. Maybe next time I'll talk about constipation, because that's obviously a big problem too. So talk to you soon.